Raise your hand if you've ever made a resolution to lose weight or to get rid of those stubborn pockets of fat. I imagine a sea of hands in the air right now, including mine. It is the most popular resolution and also the one with the highest failure rate. And here to help you finally see some success is our beauty coach, Dr. Therese Stubbs of Therese Aesthetic Medicine. Welcome, Dr. Ann.
Thanks for having me.
All right, men, women, it doesn't matter. Folks from all walks of life want to lose weight, right?
Right. It's the biggest New Year's resolution. I think we looked up the statistics, and it's amazingly, it's prevalently the most popular New Year's resolution, but it's also the one that people fail at the most. It's a terrible thing, but they go back to their old habits or basically find that there's an area of fat that just doesn't go away even when they are working out, or whether they're eating differently in those fatty areas that maybe won't go away.
And you can help us with this, right? You can help us finally succeed.
Quite a few technologies out there now. We will basically start by talking about smart lipo.
Okay.
Smart lipo is less aggressive and less invasive than traditional liposuction, so people don't have to undergo general anesthesia. It's an office-based procedure. We numb up just a little local area, and then we take a tiny little laser that looks like a piece of angel hair pasta through a tiny little needle hole, and we melt that layer of fat, and then we take an equally small kind of little suction catheter and suction that out. So basically we can get rid of tummies, love handles, inners, outer thighs. We can do arms with that and kind of sculpt the back of the arm. So it's a very thin little laser, and it melts the fat.
How much are we talking? How much weight?
Basically, we tell people look for inches less than weight, because people want to look different in their clothes, feel better in short sleeve shirts, or that kind of thing. The inches will definitely go, and then the laser tightens the skin too. So when we've taken that fat out, the skin over the next few months tightens down nicely over top of that, sometimes eliminating the need for maybe a tummy tuck or a big long incision on the arm. We can tighten the skin and remove the fat at the same time.
How do we know if we are a good candidate for it?
Well, basically this is fat that's on the outside of the muscle. So if we're talking about a tummy, I tell people do kind of a half sit up, and if you can grab what's in front of that muscle wall, that's the fat that we can get.
Okay.
There's visceral fat that you're seeing a diagram now. The visceral fat is inside the abdomen around organs. So we can't melt that with the laser because that would be going internally. The fat that we can get is what's called subcutaneous fat. It's right in front of the muscle wall on the belly or the love handles. And so that little kind of do a half sit up, and if you can pinch it in front of that muscle wall, we can get it.
What are your most popular solutions?
Well, basically the other popular solution is cool sculpting. Some people don't want surgery. They don't even want that little bit of a procedure with the laser lipo. They said, I'd rather do something non-invasive, and cool sculpting is a wonderful solution. It basically freezes the fat. So it's just a little suction cup. If you can squeeze it, we can freeze it. So basically, if you can kind of take that little area of fat and pinch it, and it will be frozen in a little kind of suction cup almost for an hour. Those fat cells in the body break open when they're frozen, and then your body naturally clears them in the next 30 days or so.
And we're seeing results right here.
And about 30 days later, if you want another treatment, we can treat the exact same area. This is great for people who might be on anticoagulants, something where they can't have surgery because they're on a blood thinner. It's great for diabetics. Sometimes diabetic people don't heal as well with a surgery or a procedure that's invasive. So diabetics are loving this because they don't have the risk of infection. So people who won't maybe be surgical candidates are loving the cool sculpting. And then we also have our people who don't want anything to do with needles, and then they love it because it's 1 hour in the office at a lunch break, and no garment to wear afterwards. Put your clothes on. You can work out that night. You can do everything you normally do. The area is a little numb that we treat, but people don't seem to mind that if the fat's going away.
How long till we see results?
Usually you see it in the next 30 days, then at 90 days is kind of where you're going to be from that procedure. And some people say, okay, I'm going to wait that 90 days and do it again. Some people at 30 days go, I already see it working, and I want to hit that area again and get a little more results. So it's an hour for each area, and it's basically something you can be on your computer during it. You can be watching a movie. You can be sleeping during it. So it's a very comfortable procedure.
Now, you have an added incentive to help give people a great deal. Tell us about that.
Well, we're having 20% off all of our fat reducing or body sculpting treatments to help people with the New Year's resolution. I think we should add too that we really do counsel our patients too on how to eat a low glycemic or a healthier healthier diet while they're pursuing this, because that's going to help them attain their goals just in the end too. But we can freeze a certain area, melt a certain area, and they're ultimately going to be the most successful if they know how to eat with that too.
And people can book an appointment right away.
That's right. We do free consultations to see what's right for you.
Dr. Ann, thank you so much.
Thanks for having me.